Morning, everyone, and welcome to another great Messer workshop. Wednesday of all days. We've got a great webinar scheduled for you today. Appreciate your patience as we had a little bit of a technical issue getting the video up, but what would St. Patrick's Day be without a little shenanigans going on? So we're happy to have some great people with us today. I can attest to my opportunities to travel all over the country on behalf of Messer Financial Group and meet with various carriers and various carrier teams. And I can tell you that the staff that we work with here in our home state of North Carolina with Aetna is one of the best, if not the best, in the entire country. And a lot of that falls to Mr. Chris Hoff and his efforts and those team members that you'll be hearing from today. Great opportunity for you guys. A lot of things going on in the world of insurance, but we wanted to bring something to you today to help you, those experienced folks in the DSNP world, and for those people thinking about getting involved into it, what you need to know, what you need to understand, and what a great product that Aetna brings to the table here in North Carolina. So since we're running a couple minutes behind, I'm going to talk a little bit faster, which is hard for a kid from Alabama to do. But if you haven't gotten contracted yet with Aetna and you want to work with Messer Financial Group, give us a call today at 866-568-9649, and we'll be happy to walk you through that process with the producer support team. And we look forward to working with you and helping you. And if you got any additional questions, I'm going to go over the agenda here since we are running a little tight. I'm going to turn it over to Chris, and then we're going to work through the training. We'll try to address as many questions as we can. So if you guys want to throw those into the question box, I'll be monitoring that, and we'll have them answer those questions. And then we're going to hear from the team throughout the various regions in the state, the Triad, the Charlotte area, and the Western counties as well. And then we'll close out the day with just a few comments. So with that, I'm going to turn it over to my good friend and mentor, Mr. Chris Hoff. Take it away, Chris.
Thank you, Jeff. It's great to have all of you on this morning. And again, we're a little behind, and we apologize for that. And I suspect you're right. It is a St. Patrick's Day issue, but we're past that. From the eastern portion of North Carolina and the Triangle, we're going to have Clint Hill and Cynthia Halstead. She's going to be doing the training. And we had a little, as I said, a little computer issue. So from the Charlotte area, Manny's going to be pushing the PowerPoint through, and Larry Lane should be on shortly. And from the west, Tamara Benton, and Manny works with her also. And in the Triad, we've got Terry Herlica and Lauren Rooney. So we really appreciate everybody getting on. Robin Rankin, my administrative assistant, is also on. She probably takes the best notes, so God bless her for doing that. And we want to thank you for your partnership with Aetna and our great partner, Messer. So with that, I'm going to turn it over to Cynthia and get this party started. So thanks for joining us this morning.
Good morning. Unfortunately, you can't see me, and I've got purple and green on today, so I'm sad. I'm a little sad, but that's okay. That's okay. Happy St. Patty's Day. My name is Cynthia Halstead. I am the community liaison for the Triangle and Eastern area. There are two counterparts of mine on here as well, Lauren Rooney and Manuel Cassio. They are basically the same exact situation, except for they're in the western part of the state, and they'll be talking a little bit later. But just to kind of give you, if you want to go ahead and go to the next slide, Manny, we're going to just kind of run through real quick, just in case you don't know who everybody is. You can get pictures of everybody, and we'll go through a little later on, who everybody is in the map of North Carolina. But to get started, and first, before we even go through benefits, our dual SNP plan, I'm a little biased, obviously, but I truly believe that it is absolutely number one in the state right now. When you look at benefits side by side, nobody even comes close in comparison to what we're doing. But when you sell it, I do want to talk about kind of the upfront things first, because selling it for us is a little different than everybody else. We do accept different levels of Medicaid. And so, our dual eligible plan, you can go anywhere from Q and B up. And let me clarify what that means to you, because I think there's some confusion on what partial and full means. And so when people think of partial and full, they're thinking of LIS categories, but LIS has absolutely nothing to do with Medicaid. These are two completely different things. And so we want to make sure that we're clear. When you look at partial dual, that means that they have partial Medicaid, right? Partial Medicaid. And so The easiest way to understand what we accept is if their cost shares are covered by Medicaid, then we're going to take them. That's the easiest way to figure that out before you even call anybody or do anything, just to kind of figure out if you can even talk about it with them. If they're going to the doctor's offices and the 20% that Medicare charges as being covered by Medicaid, that's the cost share, then that is going to be within our categories. And so there's a couple of different ways that you need to make sure that you're actually checking status to see if they actually do have the correct categories to be able to get in with us. So if you want to go to the next one, Manny, pretty please. You can call broker services, obviously, and this is the preferred option only purely because they have a couple of different ways that they can check. So broker services, if you want to take a picture of this screen, this is going to give you the information for this. It's basically 866-714-9301. You're going to choose option 7. Make sure that you're listening for the prompt of the dual SNP eligibility verification, because if you don't do that, you'll end up somewhere else, and then you're going to get the runaround and get very aggravated. And I was an agent once upon a time, and that is one of the most frustrating things to happen to you while you're in a house with a client. So just make sure you're choosing option 7 and make sure that you're waiting for that dual SNP eligibility prompt. And then once you get to that, they'll be able to look it up. For Medicaid status, we can actually look that up with name and date of birth. We do not necessarily need Medicare numbers for that. So just so you're aware, a lot of people say, oh, you have to have a Social Security number. You do not. You do not need that to be able to look up Medicaid status. We can look it up by Medicaid number. We can look it up by name and date of birth, or we can look it up, obviously, under the Medicare number as well. So there's just different ways that you can do that, just so you're aware. The next one, please, Manny. The other option is our Ascend app. In our Ascend app, you have a couple of different things you can do in here, but we've added this year new under Enroll a Prospect. And once you get through the 2021 plan, click, then you're going to find where you can actually look up eligibility for not only LIS, but you can also look up eligibility for our Medicaid. So there's a couple of different ways that you can do this. The Ascend app is nice because broker services is not open 24/7, right? So you could be in a house at 10 o'clock at night, and yes, there are those of you out there that do that. You want to be able to get through to somebody to be able to check the status. You can do this on the Ascend app now, which is nice. So we've added that for that extra protection for you. So if there's any questions on that, I'll take the questions at the end, but I just wanted to kind of go through the housekeeping stuff first, because we have a lot of folks out there that if somebody has United or Humana or Cigna or WellCare, they assume they automatically qualify for us and write the app. And then it gets kicked back because they do not have the proper level. So we want to make sure everybody is aware. We do take different levels than some of the other carriers, and so you do need to make sure that you are verifying prior to enrolling them. Okay? Awesome. Next one, Manny. So North Carolina, this is kind of our expansions that I wanted to kind of point out. We were originally only in a few counties in the Triangle Triad area, and we expanded up to 18, which is huge for us. And I'm hoping, crossing our fingers, Chris, that we'll get some more expansion next year. Just throwing that little out there. But it's exciting. It's exciting, and we have made the plan a little different in some of the areas, and I'm going to go over that next with you. If you want to go ahead and go to the next slide, Manny. I'm trying to go through this fast because we're running late. I apologize. So we have 4 different programs now in the state of North Carolina. The Triangle and Eastern is the same as 002. We did expand, and I'm pointing this out because I have talked to probably 30 brokers in this last month that had no idea that we were in some of these counties. And so I want you to pay attention, please, to the expansion counties. We are in Durham, Edgecombe, Franklin, Granville, Johnston, Nash, Orange, Person, Pitt, Vance, Wake, Warren, and Wilson. Again, if you want to take a picture of this or a screenshot, that would be great, so you kind of have this on hand. Triad area, we did not do an expansion there, so we are still in the Alamance, Davison, Guilford, Randolph, and Rockingham counties. Charlotte is a complete expansion. You've got Caribous, and if I say any of these wrong, somebody yell at me. Cabarrus, Gaston, Mecklenburg, and Union. Western, you've got Buncombe, Haywood, Henderson, Jackson, Macon, and Rutherford. So again, these are all counties a lot of folks didn't even know we expanded, and the ones that didn't realize we expanded to so many counties. So please make sure you take note of this. And again, we're going to go through the benefits so you can see. On the bottom right, there is a picture of the card. That's there for a reason. The reason the card is there is because we want you to see something very important on the card. If you notice, it says Medicare HMO. Under that, it says Medicare Dental EPO. That is a very different contract, right? And so on the card, that should help the people when they give it to them at the place. But I wanted to point that out because we're going to get into that when we get over to the dental on what makes us a little different on our dental. So go ahead, Manny. So our programs, again, are pretty close to being similar all the way across the board. The only difference is on your dental, there's no difference. On your eyewear, there's a little bit of difference depending on the area that you're in. And I will send this out to everybody when we're done here today. I'll give it to Chris, and then Chris can send it out to your group so everybody has this. This is a plan guide, and we want to make sure that you're aware of the differences, because last year, if you sold for us last year, the plans were exactly the same. Triad and Triangle, the plans were identical. That is no longer the case. There's a few reasons behind that, and I'll get into that in a few here when we get to the next slide and kind of go through the actual benefits. Obviously, if they have Medicare and Medicaid and they're full dual eligible, their co-payments are all going to be zero for all of their medical coverage, right? So all of their Medicare coverage services are all going to be zero. Nothing's going to change there. So what we're going to dive into is the differences between us and some of the other carriers on the extra benefits, So if you want to go ahead and switch over for me, Manny, we'll go into that. On our dental, it's my favorite benefit. I talk about it a lot. I actually do a lot of lunch and learns with the providers for dental because they don't understand it either because they're not used to it. So what we need to point out more than anything else, guys, is that we cover every code. And let me explain what that means. First of all, this is first dollar coverage, right? So if they go to the dentist, there's none of that reimbursement nonsense or 50% or none of that. This is first dollar coverage. They get $4,000 per year to spend on anything they want except teeth whitening. So just so you're aware, there's over 700 dental codes, 700 dental codes out there. The competitor only covers 146 of those. And out of that 146 that they cover, 131 of them have caps and limitations on it. That's huge. Think about that. We cover all 700 plus except teeth whitening. So we have expanded our benefit to include everything and anything. And what that means to the dentist is huge, because a dentist hates insurance for a reason. Most of the time, they'll put a plan of action together for their client, right? And they'll send that to the insurance carrier, and the insurance carrier comes back and says, well, we can't cover this, or you can only have this once every 2 years or once every 5 years. And that's such a big problem for them because they have to completely change their plan of action for that client, for that patient. That's a problem. So we don't do any of that. There's no exceptions. There's no limits. You know, if they want to get their teeth cleaned every month, they can. There's literally no exceptions to that. So, you know, it is a huge benefit for the client. The benefit is only $500 more than the competition. I get it. However, it is a completely different benefit. Please be aware of that, because if you don't know that, then you're not going to know to change these people or to look at these people or give them a second guess, to be honest with you. Again, we cover all dental codes except teeth whitening, and that includes implants, all dental codes, which the competition does not cover implants. So just throwing that out there, I believe that is truly our biggest benefit. Once the dentists get on board, guys, we have probably 30 agents that I know of that live primarily on provider marketing. That's how they make their money. They don't do any leads. They don't do any mailers. They don't do anything else. They just do provider marketing, and the provider sends them referrals. We're doing events in the actual dentist offices. So please be aware of the dental benefit. And if you want to set up lunch and learns, we can do that. No problem. You just set it up. Let me know. I'll be there and I'll help you do that. That's not a problem. But it's a very big benefit that a lot of the people out here really don't pay too much attention to. So we just want to make sure you're aware of it. Second thing that I want to talk about is the healthy food card. Obviously, the healthy food card is a nice benefit. I get a lot of kickback on it, because they don't understand how it works. And so just to kind of run through this, and it is different in some of the different areas, it's $25 to $30 depending on the area that you're in. So it's $25 in Charlotte and it's $30 in the other three areas. So this is basically the same. Think of it like a food stamp card, right? So if somebody goes in with a food stamp card, which is now a little credit card that they use, and they swipe their card and they spend $75 and only $30 is covered, it's going to take the $30 off and it's going to have them pay the remaining balance. They don't have to go through, it's not like WIC where they have to go through the shopping line 3 or 4 different times, or, put the little things in between their orders. They don't have to do any of that. They shop like they normally would. They scan the card and it automatically takes the dollar amount off. So that's a big deal as far as convenience of use, right? There is a multitude of places that they can go to, and we do have the biggies like Walmart, Food Lion, we have them. So, but there's a whole list. When they sign up for this, they actually get it sent to them. Now, here's the catch, and the only reason I call it a catch is because this is where you guys come in and we need your help. We want to make sure that you understand this is not an automatic benefit going to the client when they sign up for our dual SNP plan. They do need to call the care management team. If they don't call the care management team, this card will not be sent to them automatically. They have to call the care management team. So please be aware of that, because if you sign somebody up and you don't tell them that, then that sometimes causes a little bit of a problem for you and a headache because the client is complaining. So we want to make sure you're aware. They do need to call care management and get that done on their end, so that way they can get their card as soon as possible and start using that benefit. Hearing. This is also a huge benefit for us. Our hearing benefit is the largest in the state, which is nice, and it works very differently. So, a lot of places will give you $500, $900 towards a hearing aid. However, you can only do it once every 2 years, and you can only get a certain level of hearing aid, which I call it the Medicaid hearing aid, because sometimes it's just you got to tweak it 15 times to get it to work. We actually have a hearing benefit that allows you to have $2,500 per ear per year. That's a $5,000 per year benefit, which is huge. And it allows them to get a level 5 hearing aid, which is second to highest, by the way. So that's a big deal. It's a very nice benefit. And, a lot of your hearing out there some of the competition, for instance, will require you to put a deductible or a down payment. That is not the case with us. This is first dollar coverage, and we're doing this every single year. So if they get, $2,500 per ear per year, and they get a set of hearing aids, and the next year their hearing gets worse, because believe it or not, it's like vision. It does happen. They can go back in the next year and use the $5,000 benefit all over again if they want to, or get a second set, right? Sometimes people need a different set of hearing aids to watch television than they do when they go to a restaurant or a seminar, because the background noise is different. So the nice part is it's every single year. It's a $5,000 benefit. Like I said, $2,500 per ear per year. This is through Nations Hearing, so they do need to go through Nations Hearing to set up the appointment, obviously. But again, it's a nice benefit. It's out there, and I just want you to be aware of it, because again, when you're looking at the competition, one of them charges a deductible that you have to pay up front, or a co-payment. The other one only gives them a certain dollar amount, which is nowhere near enough to buy the hearing aid, or if it is, it's going to give them, like I said, the Medicaid version hearing aid. It's the level 1 or 2 hearing aid, which is not very good. So when it comes to us versus the competition, it's not even close. It's not even in the same ball game. In-home support, we haven't talked about that much this year. And over in the Western, unfortunately, it's not available. And that's purely because we don't have anybody that wants to go up into the mountains to take care of folks. I know that sounds crazy, but it's the truth. We just don't have any providers up in that way and up in the mountains. But in Charlotte Triad and Triangle Eastern area, you do have the in-home support. And what this is, I think there's some confusion out there about what the program is and how it works. And people say, oh, Medicare covers or Medicaid covers in-home health care. Well, they do and they don't, right? They cover it for rehabilitation purposes. and Medicaid will only cover it under certain circumstances. So this is completely different benefit. In-home support is going to allow somebody to have somebody come in to help them do some minor cleaning, some prep, meal prep, light housekeeping. We actually have a company that is now helping them do their shopping, which is huge. So, there's a lot of different things here. But what I always look at it from the aspect of my mom, for instance, lives in Florida. So I can't be there with her, obviously. And when she has a surgery, she goes home after that surgery and she's stuck in that house for 2 weeks before she can even start physical therapy in most cases. And the biggest problem we have in the world today is these folks end up falling because they're trying to do too much for themselves, right? Or they don't eat properly and they end up right back in the hospital. And so we're trying to prevent that. So with the in-home support, they're getting 20 hours per quarter, and it does roll over. So if I know that I'm having an elective hip replacement, for instance, in October, then I can actually roll over my first 2 quarters, right, of the 20 hours into the third quarter. So now I have 60 hours that I can use all in 1 week if I wanted to. That way, somebody's there with me 8 hours a day to get the mail, to help me with the food prep. I don't have to worry about getting up and trying to do these things and falling and going back into the hospital. I can have somebody there for a whole week with me. So think of it like that. I try to kind of think outside the box on how these benefits can best help our clients. And that's probably the best way to use that benefit, to be honest with you, is if you know you have a surgery coming up, use it. Use that, bank the hours, roll them over, and just use them all in 1 week if you want to. So that way you've got somebody there taking care of you and you don't hurt yourself trying to get back in. And that's how you sell it to the client, honestly, the in-home support. Vision, $300 for frames and contact lenses. No restrictions or limitations. So again, our benefit is very different in that sense that you don't have all of those limitations where you can only do this or that, you can only get this or that. You're going to get $300 to spend how you want on the frames and contact lenses. So that's big. Again, we're trying to make these benefits as easy as possible to use for the client, and you need to know the behind the scenes on how those things kind of work. Transportation, we get 48 one-way trips, and where we are different from the competition is we go a little further. So if you're dealing with people up in, especially out in the mountains, for good grief, I mean, some of those people are in the middle of the boonies, right? And then over here in the Triangle area, if you go up into, Norlina or Henderson area, it's 60 miles one way just to get to a doctor in some cases, if they want to go into the Raleigh area for a doctor. So we are providing 60 miles each way. And where we're different is most of the carriers are doing 35 to 50 miles each way. So we are doing 60 miles each way. And we use Lyft and Uber when needed, if we can get them, right? So if they don't need, if it's not a wheelchair and they don't need a lift of some kind, then we can most of the time work with the Lyft and the Uber company. And I've had feedback where people have said, oh, she called and they were there within 7 minutes. I mean, that's huge. If you are familiar with the transportation benefit at all, I've been working with company ABC, the competition, for many, many years. And the biggest complaint, believe it or not, is the transportation. Sometimes the people don't show up at all. And when they do show up, they're 2 hours late sometimes. The clients are sitting there in the waiting room for 2 hours waiting for transportation to pick them back up, which is just crazy. We don't do any of that. So if we can't get somebody there soon, fast, quick, then we're going to use Lyft and we're going to use Uber if we need to. And we use Access to Care for that. So the benefit goes through Access to Care, which is nice. So some of the things that you need to know about with care management, everybody on our plan gets a care manager. So that is also different from the competition. A lot of the competition, they go by how good or fast they are, right? How bad they are, how sick they are, how many medications they have. We don't do any of that. So every single person on our plan gets a care manager. That care manager is important because in order for them to get the healthy food card, in order for them to get transportation, and in order for them to get the in-home support, those 3 benefits have to go through the care manager. Please be aware of that. So again, you just need to make sure you're relaying that information to the client so they're not confused and they're trying to call around. If they call the customer service number on the back of their card, if they don't get switched over to the dual SNP team, then the customer service, is going to be lost trying to figure out who you contact to get all these things done. They're now sending people over to the dual SNP team to where they can make sure they get them with their care manager to get these things done. So again, the 3 benefits: healthy foods card, in-home support, and transportation does need to go through the care management team. Okay, go ahead, Manny. Over-the-counter benefits, last year we got a lot of complaints because the benefit was only $210. It was very low, and so we did raise this up. I will let you know that, believe it or not, a very small percentage uses the whole 360, and that's why we had it so low last year. But we did it purely to make the brokers happy, to be honest with you. Everybody was asking for more money, so we gave it to you. So we are now at 360, which again is higher than most of the competition out there. This does not roll over, so they do need to use this within the quarter, right? And they can order 3 times within that quarter. So if they don't want to order all $360 at the same time, they don't have to. That's okay. The catalog is different this year. I'm very excited to say there is now pictures in our catalog, and our catalog is colored. And it's very nice. I love it. It's actually one of my favorite things to show to people when I'm at my events because they get real excited about it. It's very easy to read. It has pictures on what the actual products are. All of our products come through the CVS mail order, so they are CVS branded products, just so you're aware. And we do now, as of, a month ago now, we have expanded this benefit to where you can now use it in CVS stores. However, before you get too excited, it's only certain CVS stores, and in the Triangle area, we don't have any. So this is purely something for the outskirts. And if you get with your broker manager, they can actually tell you how to find the stores that are actually in the provider network that actually have it set up to where you can use the OTC benefit at the actual CVS store. But you're able to actually log in and see which stores that consists of. But for now, in my area anyway, unfortunately, we don't have any. But on the outskirts, there's actually quite a few. So your broker managers can definitely get that information out to you. But that's exciting because in the past, it was through mail order only. You could not go into a CVS store. So we have changed that benefit again to make you all very happy. Meals, members can receive 14 meals over a 7-day period. Again, this is after they spent time in the hospital. We are trying to keep them out of the hospital, folks. And the best way to do that, again, is to make sure that they are being taken care of, which is that in-home support, and also make sure that they're being fed properly and they have the food that they need. So we're just trying to keep them out of the hospital. And one of the 2 reasons they end up falling again, right? Or they end up not eating properly and they end up right back in the hospital. So we want to make sure that that doesn't happen. Silver Sneakers, we just had a meeting with them actually the other day, I'm pretty excited to say, and they've added virtual meetings. So if you're familiar with Silver Sneakers, they have a program that I absolutely love, and it's huge. It's a huge benefit, and most people that have Silver Sneakers don't even know about it. It's a program where the member can actually sign up, and they can put beneficiaries down for their grandchildren or any relative, really, that is a direct connection to them. And every time they go in, it's an awards program for college tuition. And every time they go into either a virtual class or they actually go into a physical membership class, they get points. And every time they get points, that adds up. They can actually get up to $4,000 a year off of tuition at certain colleges. That's huge, just for exercising, just for doing what they're already doing. Now, it's not automatic. They do have to sign up for this, but you as brokers, this is a selling point for sure, especially, again, considering that you're going up against competition, right? Because the competition doesn't even have Silver Sneakers anymore, some of them. So, Silver Sneakers is a big deal, and you want to make sure that you're talking about it. And a lot of brokers say, oh, Silver Sneakers is just a free gym membership, and they leave it at that. Oh man, it is so much more than a free gym membership. And so I would suggest for you as the broker to do a little bit of research on this, because that is a big selling point for the Silver Sneakers program. Again, $4,000 a year, that's a lot of money, guys. And if you have kids in college, that's huge. So please, and if you have questions about any of these things, I'm going to give you my email. Chris has all the contact information for all of us. Please make sure you reach out to us and we can kind of dig in a little deeper. I know we're running out of time, but I just wanted to make sure that you're aware of the different things that Silver Sneakers does. It's not just about a free gym membership. Model care team, like I said, everybody on the plan gets one. So we've already actually gone over that, so I'm going to skip right by that. Podiatry. Podiatry is huge because we are the only carrier covering 12 visits a year. And if you're familiar with diabetes, diabetics are actually not supposed to be going and getting pedicures at the local salon. That's actually a no-no. And that's because they can actually end up with some very bad diseases, and they don't actually fix themselves up, so to speak, very well, right? And so they're supposed to be going to a podiatrist to get these things done. Most carriers, actually almost all of them, cover 4 visits a year. We cover 12. They can go every single month with us. So if you have somebody on diabetes, that's diabetic, that's on diabetes medication, this is a big deal. 12 visits a year. And again, if you're looking to do marketing, podiatry, again, the podiatrist is the great place to start. Let them know that, because we're the only carrier that does it. So if you can let them know that we're covering 12 visits a year, they're going to push the product and they're going to send referrals to you. So I would suggest you reach out to some of your local podiatrists that are in our dual SNP plan and start marketing to them for yourself. The emergency care obviously is the same across the board. Personal emergency response system, where we're different, is we actually give them the option. So most carriers will give them the push button that goes about 900 feet from their house. We actually give them the option to have that button, or they can actually have a mobile device, and it has GPS and fall detection on it. So if they actually go to, 600 miles away to the middle of the world and they fall, and it has a GPS location, it's mobile. It goes anywhere, 24/7 access. So it's not 900 feet from their house. So, we have a lot of people that go grocery shopping and different things like that, and they fall down in the parking lot. This is a nice option for them. And to boot, again, not only is it mobile, but it's water resistant, and it has the fall detection. So when I give this to the clients, I don't even really tell them to get the in-house system, to be honest with you. I automatically tell them you might as well get the mobile device. It doesn't even make sense to get the in-home system unless you're completely homebound and you never leave. It does not make sense to me to ever do the home system. It would 100% make more sense. Not only that, the home system is a little frustrating because most of the time it requires a landline. And even when it doesn't require a landline, it does require some wiring in the house, which becomes a little frustrating for the client. So the mobile device is definitely the better way to go as far as I'm concerned. Go ahead, Manny. So just to kind of go over prescriptions real quick, and this is actually the biggest feedback we get about the competition is, they cover all 4 medications at zero copay. So I'm going to just nip that right now. Yes, that is the case. However, my mom is on 17 medications per day. 17. She's permanently disabled. She lives in Florida. She's on 17 per day. And out of all 17 of those medications, only 2 of them are name brand. So first of all, when you run into people that are dual SNP, almost always they're on generic. But even when they're not, even when they are on name brands, if they're full dual eligible, so they have full Medicaid and full Medicare and full subsidy, they're only going to pay $4 maximum for that medication. So in my mom's case, it would be $8 a month for her medications. Out of all 17, she would pay $8 a month for all of those medications versus free. However, what she's getting on the other side of that is an unlimited dental that's not going to cause her headaches and pains, right? She's going to get, again, the $4,000, it's huge. And there's no background, there's no problems, there's no exceptions. They get it done, whatever they need to get done, when they need to get it done. No reimbursement issues, none of that kind of stuff. This is first dollar coverage. All of the other benefits are higher. And so to give all of that up for $8 a month, I'm not real sure that would be a good reasoning. And I think what brokers tend to do is we look at prescriptions first, which is great. I understand that because we do want to make sure they're all covered. But at the same time, we also don't want to be hurting the client by not giving them all the other benefits that they could have. So yes, again, I understand the competition is 0 and we would be 8 in this case. It's a rarity that you run into that. I mean, I've got a broker that sells primarily for us, and out of 25 applications, he's only given 1 to the other carrier for the prescription situation. However, that client was on like 12 name brand medications. So there are exceptions to every rule. I understand that, and we can't win them all. I also understand that, but don't count us out just about the prescriptions, please, because you're giving up a whole lot on the other end with the other benefits when you do that. So I just wanted to kind of point that out. I think what happens is you tend to look at the $9.20 and say, okay, they got to pay $9.20 for every medication. Again, if they're full dual eligible, if they have full dual eligible status, it's not $9.20, it's $4. So please make sure you're aware of that and you understand how that all works. Okay, go ahead, Manny. So Chris wanted me to take just 2 minutes to kind of talk about how to market our dual SNP plan. Manny, I lost you. There you go. What you need to make sure you're aware of is all the different things that are out there available to you. I've already talked about provider marketing quite a few times, but centers of influence, people and organizations who can boost your market access, that's going to be anything from providers to laundromats to, churches, to missionaries, to senior centers. I mean, there's so many different things that you could do. I mean, we've got entire agencies that do not even run leads. They primarily do events, and most of them do a lot of provider marketing. There's different ways you can market yourself without spending a bunch of money, I guess is the point. So just keep in mind that all of these places you can get into for free. You don't have to pay anything. And you can do events there, what we call an informal event, where we set up a table at a food bank and, 150 people come through to get food and you're getting 20, 25 leads out of that. That doesn't cost you a dime. We actually sponsor it because it's under an Aetna event. So just keep in mind that there's lots of different ways that you can market with our program. And we have a program called Special Forces too that, if you're interested and you want to get on board, I mean, we've got to earn our way into that Special Forces team, but I want to make sure you're aware of it, that we do have programs that we actually sponsor you as an individual for our dual SNP program, where if you're really wanting to get into this and you're really wanting to kind of market for us primarily, reach out to your broker managers and talk to them about this, because if you start selling our dual SNP and you get into this program, we'll give you, Medicare Marketing Studio money, and we'll give you materials for free that you need. We'll give you the tablecloth. We'll give you the signage. We'll give you everything that you need and sponsor you completely 100% for these events. So just reach out to your broker managers and let them know that you're interested, and then maybe you guys can talk that through. Go ahead, Manny. And the Medicare Marketing Studio, if you've never been in it, it is one of my absolute favorite places on earth. I am in there every single day. And you can actually customize for yourself Aetna product materials. So you can actually go in and get a flyer, for instance, on the next one, More For You flyer. This is our dual SNP flyer. You can have your picture on there, your cell phone number on there, your name, everything, and this can go into different facilities. You also have the pull tab, so if you wanted to put it in a laundromat or on a community board at a low-income housing center, you can actually pull the tabs and they'll call you again. This is completely customizable, where you can put your name, phone number, and sometimes your picture on there, which is a big deal. So laundromats and community boards is where these work real good. And then we also are coming out with a trifold for the provider offices for you as well, that you'll be able to customize and put your information on there. So when they're sitting in the waiting room at the provider office, they pull that pamphlet. It's got your name and number on it. They're going to call you for that. Go ahead, Manny. I think that should be it. That's it. All right, Chris, I am all set. If there's any questions at all, I guess now would probably be the time to ask them.
Thank you, Cynthia. That was great, and we really appreciate it. Jeff, do you have any questions in the chat box?
Yeah, we've got a couple here. One of the first ones is referring back to the dental. If a person is missing a tooth, could they use the implant benefit there, Chris, with that, or Cheryl?
Yes, they absolutely can. Again, they can do anything and everything they want to with this benefit except teeth whitening. So, and I mean anything. If they lose a cap, if they lose a crown, I mean, some of the carriers, if you lose your crown and you don't have the crown when you walk back in to get it replaced, you can't get another crown for 5 years on that tooth. That's just crazy. I mean, think about that. That's crazy. So we don't do any of that. The benefit is 100% wide open. When I say that, I truly do mean it. It is one. Matter of fact, if you go into our EOC, it doesn't even break down the codes because there's no need to, because we cover them all except for teeth whitening. So it's just very different benefit. And I think that brokers very, very much need to talk about this with the client. So hopefully that answers that question for you.
That's great. That's great. Tell me a little bit more about the health food card and the conditions that are associated with that. In the slide that you had there, it mentioned some chronic conditions. What should I be looking for in one of my members if I feel like they're in need of that card? And then on top of that, how again do I access or help them access that card benefit?
Okay, so it does need to go through the care manager. So again, the first thing that you want to do is make sure that you let the client, at the time that you sell the policy, make sure you let the client know that they do need to reach out to the care manager within the next couple of weeks to make sure that they're contacting them, they get that interview done, and they actually make sure that they get that food card going. As far as what the ailments are, what I will say first and foremost, and I might get shot for saying this, but I'm going to say it anyway, we have yet to have anybody decline for this card. Just throwing that out there.
That's 100% true. Yes.
Yeah, the broker
you have to
starts
go
to kind of have
care
this,
management, but no one's been denied yet. So, and there's
nobody
hundreds
has been denied.
of people on this plan.
Yeah, so I'm just throwing it out there. You know, we were required to file this a certain way with CMS, right? And so, you know, the chronic conditions include, you know, autoimmune disorders, cancer, cardiovascular, chronic heart. I mean, the list goes on and on, diabetes, liver disease. But if you have somebody that has absolutely no medications and nothing wrong with them, again, that's a rarity in the dual SNP world. But if you did and they have no medications and they have absolutely nothing wrong with them, is there a chance they could get declined? I guess yes. However, we have not had one single one declined yet, not one out of all of our members. So I'm just letting you know.
All right, we're knocking on wood on that. So again, how would I find out, or how do I get in touch with the care management team? Is there a number that the agent will have with them?
Actually, there is, and I'm actually going to send you. I'll send a whole packet of just different things, flyers and brochures and things for your brokers if you want to spread the word. But there is a piece that's on Medicare Marketing Studio that I actually suggest for folks to actually use when they sell a policy. It's a leave behind piece that they leave there, and it tells the client specifically on their plan what's going to happen over the next 90 days. So they're not calling you every 5 minutes asking where their card is. And on that, front and back, is the care management telephone number. That's all on that sheet. So now, until you get that, I am going to give you the phone number so you have it. So if you have a pen and you want to write this down. It is 800-241-9379. And that's the direct line to our Aetna care management team.
Awesome. And we will share when you guys send out the packet to me. We'll make sure that everybody that attends today gets that information so that they'll have it with them when they do their presentations. Tell me a little bit more about the in-home support and what's included there and how important that is, because obviously the agents have a bunch of stories. I know Tamara's shaking her head, some of the things she's seen out in the field as far as just basic hygiene for some of these folks that we're trying to help. Tell me a little bit about what's included in the in-home support.
Yeah, so in-home support, I will tell you, my mother is a hoarder. I know I talk about my mother a lot, but she is probably my one client, God love her, that is, you know, our family's always the worst ones, right? It's kind of the way it works. But my mother is a hoarder. And I only bring that up because when you're talking about cleanliness and just different things like that, it is on the list of things that we worry about family members, right? And it tends to get to a point where Meals on Wheels can't even get in the door to bring the food inside. And that's a major problem. And so that is a perfect example of how in-home support would help. No, they're not going to clean it all up, obviously. I mean, if they're hoarding and they can barely walk through the building, that's a problem. However, they will reach out to the care management team and let them know what's happening in that house. And then the care management team can actually hook them up with a resource for somebody to come in there. They'll reach out to the kids if they need to, and they're going to have somebody come in. In my mom's case, they have somebody coming in and they're actually going through and cleaning the house out. What do you want to keep? What do you not want to keep? I don't know if you've ever seen one of those crazy shows, the hoarders shows, where they come in and the person's having a complete meltdown. That would be my mother, but my point is it all happened because of Meals on Wheels and in-home support. It's a big deal. So just, keep in mind, this in-home support is a lot more than we think it is. They're going to help them cook and clean, obviously, but they're not deep cleaning. They're just straightening things up to where they can get, up and down the hallway in their walker or their wheelchair. They're not going to go in. It's not like a maid service. So they're not going to go in and do a deep clean, but they are going to help them with the basic things. And again, we do have them now shopping for them as well. So if they have a shopping list when they get there and they need them to go shopping, they'll go up to the store and shop for them and bring the groceries back. And we are currently working on maybe expanding our provider network on that, which would be nice. And that would actually allow them to be able to take the person somewhere like a Starbucks or something like that and be able to sit down and just have a conversation with them and keep them company, so to speak. So there's many different ways the in-home support benefit can work. What I'll do is, again, include a flyer on that for you guys so you can kind of get in depth with that. But hopefully that kind of gives you a little bit more explanation on it and what it can help with. And again, it's 20 hours per quarter, and it does roll over. It does roll over. It does not roll over year to year, though, just to be clear. It only rolls over quarter to quarter. It does not roll over year to year. So at the end of the year, if they haven't used it, it does not roll over to the next year.
So again, that's 20 hours of a quarterly rollover for that service. Perfect.
Correct. And it is a 3-hour. It is a 3-hour minimum, just so you're aware. So if, they couldn't come an hour a day or anything like that. It's a 3-hour minimum when they do come.
Okay. I had a question bounce back to the dental aspect of the plan. What's the network like? Can you describe the size or the number of providers inside the network for us here in North Carolina?
Yes, I can actually. So here's the huge thing with the dental, and this is very confusing, so just bear with me. Yes, our plan is an HMO plan. However, when they go to the dentist, or when you as a broker, because this happens more often than not, the broker calls the dentist and says, hey, do you take the HMO with Aetna Dual SNP? Their instant answer will be no. And the reason the answer is no is because they are not contracted through our HMO. They are contracted through the EPO. So remember I told you on the card where it says the dental is EPO and where the difference is on the card? There's a difference there for a reason. So our network is very large. And basically at this point, it looks like our Dual SNP network is matching our EPO network, which is employer coverage, by the way. Our employer group coverage. And so when you're calling these folks, make sure they're not saying, do you accept the HMO with Aetna? You're asking them, do they accept the EPO with Aetna? And almost always the answer is yes. But the key here, just to give you in my zip code. So I live in Cary, North Carolina, and within 20 miles of my zip code, there is over 2,000 dentists. So our network on our dental is not an issue at all whatsoever. We actually have tons of them. And so when you get in the Western and when you get into the far Eastern, there's a little bit of a hiccup there because there's some counties where it's very small, and I understand that, but we're working on that. But it's only 2 counties that I am aware of. Manny, is that correct? In the Western, 2 counties? Tamara, 2? Yeah. So you got 2 counties in the Western that are struggling with the dental providers. And again, I think it's primarily because they're just kind of very out there. And we're working on that. Tamara has been working on that diligently for the last 6 months. So we will get that fixed up for you. But as far as everywhere else, I don't think there's any real big problems that I've heard of. Most of our areas have a huge number, especially when you get into the cities area, the higher city areas, populated areas, there is a ton of dentists. available.
So Cynthia, to your earlier point, there's really no reason that a broker couldn't or should not be out working provider relationships on the dental front, correct? With that many available in some of the metro areas.
Yeah, not at all whatsoever. I believe that 100%. I mean, every time I do an event training with a broker that wants to do events with me, I actually talk about provider marketing. I believe that that is 100% where you should start, really. I mean, we've got a broker down in Florida, believe it or not, that she only lives on provider marketing. She has 3 providers, huge providers down in West Palm area that they send all of their clients to her. She makes a living just doing that. I mean, she's 6 figures a year just doing that, just doing provider marketing. So it's big. And again, what you can do is what we call lunch and learns, where you go in, you set up with the office staff a lunch and learn where we buy them lunch and we go over a PowerPoint and explain to them our dental benefit and how it works, get them on board, and then pass them over to you, so to speak, or whoever the broker is, and that broker is going to leave their information behind, and they're going to refer all their clients to you. The best one is when they go in with the competition and they say, oh, we can't cover this, that, and that. Instead of the doctor or the dentist fighting with that competition, they instantaneously say, here, call this guy or call this lady, and she'll get you switched to a plan that will cover it. I mean, it's a big deal. The provider marketing is very big.
Awesome. I think that kind of wraps up the questions. I did have a question for Chris, so don't rub your forehead, Chris. This revolves around some of the, yeah, thank you. Chris, this revolves around some of the compelling stories that you and I have talked about where you guys have done so much community outreach that you have or have not had enough brokers to help you work those events. I thought maybe you could tell us a little bit about that and how successful they've been.
Well, we've got these nice 3 people on, well, 2 of them you can see, and you've been listening to Cindy, Lauren and Manny. And their whole job with us is to set up events around their areas so that brokers can go ahead and take advantage of the opportunity, whether it's food pantries or provider marketing or senior centers. I mean, that's just to name a few. And they're doing a really great job of setting them up. And I'm going to let them talk about it in a minute. But the truth of the matter is, we have more events than we have brokers to actually man them. And in many cases, because we don't want to cancel events, they have to run them themselves, gather those permission to contacts, and then pass them out to brokers. So we're looking for more people who want to partner with us in these efforts. And every month, the number of events grows in every single area. So we're really excited about that's how they get paid, setting up the events, getting permission to contacts. So, there's a big effort and a huge amount of resources being placed in that area. So with that, I mean, if you're about finished with that, I'd like to we've got a few minutes left, kind of go from section to section, let them speak a bit. You've listened to Cynthia. She works the Triangle and the Eastern section. And with Clint Hill as the broker manager, he had to get off because he had a training that he had to go and work on. So we're going to you've heard from Cynthia. Unless, Cynthia, you have some other comments you want to make, I'll move to somebody else.
That's right. I think that's perfect.
To answer his question real quick, just in the Triangle Eastern area, we do about 46 events a month here, and we are well over 350 leads from those. So just to give you, I know you were looking how successful they are. They're very successful, and our closing rate currently is sitting around 15%. And this doesn't cost the broker a dime. I mean, even if you do a mailer, you're getting a 0.5% return on a DualSNP mailer. Our lead source right now, our number 1 lead source for our DualSNP plan is our event, the end, without question. So they are very successful. So I just wanted to kind of point that out to you guys, and I'll pass it over to the next guy. Have a great day.
Thanks. That's perfect. No, I just want to encourage the agents to reach out to their marketing director and their broker rep, and we can help you guys get set up, making sure that you've got access to these events through Chris and his team. So now we'll move on to more of a regional view. Chris, how about that?
That's great. Thank you, Jeff. Lauren, you're in the Triad area with Terry Herlica. You want to give us a little bit overview on what's going on with your marketing efforts.
Yeah, I am Lauren Roney. I am the community liaison for the Triad area. I work with broker manager Terry Herlica. And my focus counties are Rockingham, Randolph, Davidson, and Guilford County. Like Chris said, we are reaching out and developing relationships with different centers of influence and getting events scheduled, and we need more brokers. So if you're interested, or if you have a center of influence you're working with, or you're interested in working to grow your DSNP book of business, please reach out to us. We would love to talk with you more and get you scheduled at these events. Cindy did a really great job going in depth and talking about the DSNP benefits, and I wanted to just add to the conversation, and I think it's important to add to the conversation about what we're experiencing in the field at these events. So when we're talking to folks that are on a competitor plan, sometimes they're telling us, what their benefits are, and they're surprised to learn about Aetna's benefits and how great they are. A good example of that, at the end of AEP, had a lady come by our table, and she had told me about her benefits on the competitor's plan. And when I started telling her about Aetna's benefits, specifically around the dental, in comparison to her current plan, she was ready to enroll. She drove around, parked behind her table, had her daughter drive around and park behind her table, and met with a broker right then and there. So we're having a lot of conversation and similar experience at all of our events, where folks are just now hearing about the Aetna DSNP benefits and how great they are. That's our job. We're out there helping create awareness about these benefits so that these folks are on the plan that gives them the most. So again, I'm in the Triad area. Please reach out to me if you're interested in getting involved in events. We need more brokers and need to help more folks. So that's all I have.
Thanks, Lauren. Appreciate that very much. Terry, would you like to add anything?
Yeah, I just want you to be able to contact me in the Piedmont Triad area. I'm your broker manager for those brokers that reside in 16 counties in the Triad and the Piedmont. Of course, right now we just have the DSNP primarily in those counties here in the Triad. My contact information, Chris, are you going to have a slide, or do I need to offer that?
We're going to offer that at the end.
Beautiful. I just want you to be able to get a hold of me. I know most of you I know, but I've got a ton of new agents who we haven't developed a relationship with yet. And communications will be going out to you from myself and from Lauren. We're very blessed that Aetna has taken on these folks to work as our community liaisons with this product. And from everything Cindy told you, you can see that we have a product that we're really proud of, should be way more successful at this point in the market than we have been. And we believe it's just really a lack of knowledge in us getting that information out to you, and you being able to understand really the primary differences in Aetna and the other products. So those of you that are selling it, thank you for jumping on and really diving into it. For those others, we realize this is a new thing for you. And there's going to be a learning curve, and yeah, there's going to be more stuff that you're going to have to put in your trunk unless you buy into that Ascend app. And that's one of the things that we didn't talk about was that VBE, the extra $70 when you use the Ascend app. Please jump on that. That's not just with the DSNP, but that's with everything. So if you want more information about that, give me a buzz too. I think Chris is going to give you some contact information afterwards. So thank you all for being on here. I appreciate a minute to talk to you about it. Take care.
Thanks, Terry. Now we're going over to Charlotte, general area, and Manny, he covers Charlotte and the Western, but we'll cover Charlotte first and then talk about the Western section. You got it, Manny.
All right, so my name is Manuel Casio. I do the Charlotte and Western area, as you guys already know. What we want to do, what I'm focusing on is kind of expanding both avenues. So really working with people at food pantries and stuff, and then also working with the Spanish community and trying to continue to push that as well. So what I'm kind of looking for with agents is obviously anybody who wants to be a part of different events, we can get you in there. If you're a Spanish speaker, awesome. And we can definitely get you into some of those different events that are primarily Spanish speaking events. That just helps expand getting the information out to everybody that can possibly use it. Out in the Western, you'd be surprised how many people are Spanish speakers out there, including in the Mecklenburg, Gaston area. So it's just kind of expanding what we do and how many people we can reach in a short period of time, and just continuing to grow our reach to be able to help people look at things a little bit differently. I used to be an agent as well, and sell different carriers. We all kind of have our carriers that we fall to because it's easy and we do it all the time. But reaching out and understanding how this plan works and the benefits that we have available are really amazing. And when you start looking at what people really need, you know, a healthy food card is important and is necessary, but people need teeth to chew the food, you know? So it's really just understanding the things that people can use and benefit from overall, is really important to us, and getting out to as many people as we possibly can. So definitely, if you are in my areas, reach out. We'll get you into some events. And if you want to help set up your own events, you know, we can do the provider marketing. I can do the lunch and learns with you, and then those become your events. So that's another thing to remember. You know, if you have specific places or relationships that you already have with different places. I work with brokers now that already have been going to a food pantry for a while. And, you know, one of my brokers actually was going to a food pantry and got one lead all last year. I started working with him and we already have 45 leads from that event over AEP to now. So it's amazing how just a partnership and being able to work together can show what leads can generate from, you know, being able to just talk to people, give out a little bit different information, be a different face. You know, a tablecloth is surprising what you can get when and bring attention to. So kind of reach out, let us know. We can always work with you. And if you have relationships or places you work with, let me know. We'll be happy to help and set up an event with you and work with through those things to get you any signage or whatever you need to make it pop and get that attention from people.
Thank you, Manny. Larry, want to add something? And we'll switch over to the West with Tamara after Larry.
Okay. Hey, good morning, everybody. Can you hear me okay? Okay. You know, I don't have a lot to say about it other than the opportunity is available to you. My question to you is, how are you going to grow your book this year? This opportunity presents a lot of potential. There's probably facilities right in the neighborhoods where you work where you can set up events and have us help you to set up those events. So just think about how are you going to grow your business this year. This is one segment of the market that's unserved. You know, there's a lot of other plans out there with a couple other competitors, but they don't have the strength of the plan that we have. So the members are available to you. The collateral is available through the Medicare Marketing Studio. I'm available to assist you. Manny is here to help us. So it's really just, you know, the opportunity is really amazing. The benefits are amazing. And just so you know that we're doing some brief trainings as well on Tuesday mornings at 8:45. They're a 15-minute call to talk about each of the benefits so that we can, instead of, you know, spending an hour and a half on a webinar, you know, learn about the food card in 15 minutes and get on your way at 9 o'clock. So every Tuesday morning, you can look on the Aetna Medicare Agent Training site to see when these events are occurring, or just send me an email and I'll send you the invites. So I just wanted you to know that those are available, and you know, we look forward to helping you guys to grow. That's why we're all here and you know, serve the community. It's a great feeling when you have 50 new DSNP clients under your belt, right? So you know, just reach out to us, let us know what you need, and we'll try to be there for you. So thanks everyone. Have a great year.
Thank you, Larry. Tamara, if you could tell us a little about the West, please.
Top of the morning to everybody. How is everybody this morning? Thanks for joining. We really appreciate you guys. I only have 2 points because I ditto everything everybody said. There's just a lot of opportunities. Something that happened this week I thought was very, very interesting. Had a call from a broker who said, what is this Nation's Hearing and these fantastic hearing aids? We had a member on our PPO go into get hearing aids with Nation's Hearing, And they said, oh, you need to be on that plan, another plan that gives money for these hearing aids. They're fantastic. So of course the broker's calling me going, what about this dual plan, this HMO plan? I said, you didn't know about it? What? Were you not in our virtual training? We've talked about it 150 times. So of course I reiterated it again. So if you do not know about our plans in the West, please call me if you're out there, because I'm finding that a lot of folks don't realize that our dual plan in those counties, you may come into a dual relationship or a dual meeting and find out that they're partial dual and that perhaps they do not qualify for our plan. Well, we've got a HMO that mirrors that dual plan that is absolutely fantastic. So I just encourage you to learn about our plans, our new plans. These are brand spanking new in the West, and I'm finding a lot of people still don't understand that they're out there and know about them. So call me if you are a broker in the West, and would love to talk to you about the opportunities, because there are a lot of opportunities. Have a great day.
Thank you, Tamara. And just to kind of wrap this up before I give it back to Jeff and the Messer team, I want to thank the Messer team for letting us speak this morning. And I want to acknowledge the fact that in the 7 years I've been involved with the Aetna organization, the Messer team has been our #1 partner on the FMO level every year in the Mid-South. And we really appreciate their partnership and their amazing staff. So thank you very much for Messer. Thank you from my team that's been here this morning, and for Robin Rankin, who is actually our administrative manager, and she keeps all of us under control and keeps all the stats and helps us find where we are supposed to be and make sure everything gets registered effectively and compliantly. And thank God she's here and works way too many hours. So thank you, Robin. Thank you, Jeff. And thank you, the rest of the team. So I'm going to give it back to you, Jeff.
Thanks, Chris. And I want to say a special thank you to Cynthia for her great presentation this morning. A lot of great information there. Saw a great stay rate with us, if you will, for the people that registered for the webinar and went all the way to the end with us. So I want to thank those agents for doing that. Hopefully they were able to pick up a lot of good information and tidbits that they can use as they go forward. As a reminder, guys, you got to make sure that you're contracted, that you do your certification, and that you're ready to sell before you go out and represent these products. And once you do that, you'll have access to a number of different platforms or avenues to submit these applications. And as Terry mentioned, there's a great VBE opportunity out there for you to pick up a little extra cash along the way. So not only are you making a difference in your community, but you're making a difference in your wallet as well. So I would encourage everyone to have a great rest of the week. Be safe. Enjoy your St. Patrick's Day, but do so responsibly, as we always say now that we get a little bit older, right? And if you have any questions, please reach out to us here again at Messer Financial Group at 866-568-9649. We'll make sure that you get contracted as soon as possible and make sure that you know who you need to speak to at Aetna and got you working with the correct broker manager. Again, great team over there. They love to help agents and improve themselves and their quality of life and their members. So we're really excited about any chance we get to partner with these guys. So with that, I'm going to say goodbye. And again, if you got any questions, please reach out to us, and we'll see y'all very soon. Happy St. Patrick's Day, everyone. Take care.
Bye. Thank you.